Muscular system audio lectures. So the first part we did the spine and we did the upper extremity. Now we're going to look at the lower extremity, and that'll be almost everything that we need to label for our practical. We'll just have a couple things from the physiology chapter, and just when you're looking at the actual structure of a muscle, really in depth, that we'll have to kind of label. So this will be most of the stuff that you have to find for your practical. Okay, so now we want to look at the lower extremity, and again, now we're looking at the hip, and we're looking at the knee and the lower leg, and then we're going to take a look at the foot. Okay, so when you're looking at the hip, you're looking at that front part of the thigh. Again, I'm going to know that I'm looking at the front part of the leg because, again, I can see this little kneecap here, okay? And I can go a little bit by the spine where I don't see the spinous process. There's other ways, but the kneecap is really the easiest way to sort of realize, okay, this is the front part of the leg. Most of us know that this is going to be my quadricep, right? So they know that the quadricep is in that front part of the thigh. These are the muscles up top that we're maybe not that familiar with, okay? So most of us, maybe if we played sports or we did different things, we're going to hear about the psoas muscle or the iliopsoas muscle, and these are going to be more my hip flexors, okay? And then when I get down into my quadricep, it's going to be more of a knee extender, okay? But my hip flexors, or, if I pick my leg up in front of me, I pick that knee up, it's going to be the job of these muscles. And these are the ones that usually get really tight. And these are, again, anytime you see a picture where these muscles are running up and they're attaching on the spine, it's really important because when they're really tight, and especially if you think about when I'm trying to run or I'm trying to do something really powerful and I'm trying to use all this force and I'm trying to get my leg behind me, what's going to happen when these muscles are tight is that when you get that leg behind you, they're going to start yanking on your spine, and it creates a lot of stability problems and a lot of wear and tear on the back that we don't want. Okay, so hip flexor, especially with all the sitting we do, they say the average person is going to sit for 8 to 10 hours a day. These are the muscles that are going to adapt to that position, and they're just going to get used to being in this flex position, and they're going to get really tight, and they're going to lose this ability, especially with guys. As we get a little bit older, you're going to lose this ability to kind of get your leg behind you without sort of extending your back, and I can tell you that that is the number one way that most people are going to just destroy their back over time. Okay, so these ones are, again, really important. And again, we want to think about things as in based on their location. So we said, with our shoulder, anything on the anterior part of the shoulder is going to flex my shoulder, and the hip is going to be the same. Anything on the anterior or the front part of my hip is going to be a hip flexor. Okay, and I get these two muscles. I get the psoas major and I get the iliacus muscle, and then a lot of times people will combine them and they'll just call them this iliopsoas muscle. Okay, when we move down into the quadricep, I got a couple muscles down here. Again, we want to break it down into just locations. So I can think about my thigh, and I can think about my hip, and I can think about this is the medial part of my thigh. So everything on that medial side is going to be an adductor, or it's going to bring my leg closer to midline. Everything on the lateral side, we'll see those in a second when we look at the glute, is going to be an abductor. Everything on the front part is going to be a hip flexor, okay? And then everything on the back part is going to be a hip extender. So we want, again, we don't want to memorize every single function of every muscle. We just want to know based on that location, what is the general function of those muscles going to be. Okay, so now we can see parts of the quadricep. We get this rectus femoris, we get this vastus lateralis, we get this vastus medialis. We can't see the other part of the quadricep because we'd have to take this muscle off here, but we'll see it in a second. And then I start to get a good look at all these adductors, or these are more commonly called my groin muscles, okay? So now we want to take the quadricep off of there, and we're going to see our adductors, okay? So I get all these little adductor muscles, and again, these are more commonly called like your groin muscles. You hear about them in hockey or baseball, and these are really tricky to fix again because they're just deep down under the quad and under the hamstring. They're just really sort of hard to kind of get to, and these are those injuries where people will sort of have these and they'll kind of linger like the whole season, and sometimes they'll never kind of go away, okay? But when you hear about the groin muscles, what they're talking about are those adductors, and what they're talking about are those muscles on that inside part of your thigh, okay? And again, label them based on the inside part of the thigh. That's going to be an adductor. Lateral part is going to be an abductor. So I get this adductor brevis here. I get this adductor longus, and then the adductor magnus is actually going to be this big, huge muscle that's kind of behind all of these. But again, their main function is going to be to pull this leg closer to midline, especially if I have my leg spread apart or my leg is a little more lateral. They're going to help me sort of get this leg sort of back to that midline, and they're going to help me kind of keep this knee nice and stable over top of my foot. So here's a picture of that adductor magnus. So I take off all the other ones, and then I can see that this one is going to be that big, huge one kind of underneath everything on that medial part of my thigh. And again, they're coming up, and these are the ones that are going to move my hip joint for me, okay? And then my quadricep is going to move my hip joint, but it's also going to move it's going to have a big job sort of down by my knee a little bit too. So here are the rest of the quadricep muscles. So in this one, I want to find, again, I want to find the kneecap because I know I'm looking at the front part of my thigh. I want to find this fibula because then I know that this part is lateral, right? And then I can be, okay, I have 4 parts of my quadricep because it's called a quadricep. So I have a vastus lateralis, I have a vastus medialis, and then underneath that rectus femoris, I'm going to have this vastus intermedius. So the only one that's not on here, and they kind of tell you over here that they had to cut it so that you could see that muscle underneath. Okay, so make sure you know that those are the 4 parts of the quadricep. Again, they're just based on medial, lateral, what's anterior, what's a little more posterior. And again, their main job, they're going to move this hip joint a little bit, and then they're going to they're going to do this extension of my knee. So all these muscles are going to kind of combine. They're going to form this big, huge patellar ligament here, and then they're going to help me to extend or to straighten my leg out. So now we get to the back part of the leg, and in the back part I have, again, my hamstrings. So we get the proper terms for the hamstrings here, and then we also get our glute muscles. So this glute maximus, again, all these muscles on the posterior part of my thigh, their main job is going to be to extend your hip or to bring your hip behind you, okay, or to bring your leg behind you. That's going to be the main job of this gluteus maximus. What they find now is that most people are not using their gluteus maximus, okay? Because we sit, these glute muscles get kind of turned off and they get kind of deconditioned, and we start using these hamstrings all the time to sort of move our legs around. And then what happens is we get a lot of hamstring strain. So one of the things that you always want to pay attention to is, yes, my hamstring is irritated, my hamstring is bothering me, it's sore. But sometimes the reason it's sore is because you're asking it to do something it's really not made to do. Okay, you're supposed to be using this glute max, but I'm trying to use my hamstring, and it can compensate for a little while, but it cannot compensate for a very long period of time. So very common in any sort of track and field, football, baseball, hockey, running particularly, and it kind of tells you, okay, if people have a lot of hamstring problems, sometimes it's the glute that they have to kind of strengthen out. Okay, so glute is my primary hip extender, glute maximus. We're going to look at the medius and the minimus in a second, and then I get this hamstring, very similar to the quadricep, where I have 4 parts. Okay, so I have 2 parts lateral. I get the long head and the short head of this biceps femoris. And then on the inside, I get this semitendinosus and the semimembranosus. And again, the hamstring is again made up of those 4 muscles on that back part of your leg. Okay, so here is another picture of my glute muscles. And again, you want to think about these as it's just kind of layers and layers and layers of muscle. So you can tell that they had to cut off the glute maximus, right? They had to cut it away so you can see all the other muscles. Here is my glute medius, and then the glute medius and the glute minimus, they're going to be more stabilizers, okay? So we say glute max is going to be my primary extender, and my glute medius and my glute minimus is going to be more what if I'm walking kind of laterally. So you talk about people making like side steps, or if you want to sort of work these, you can put the little elastic bands on your ankles and kind of just walk side, out to the side, 10 steps one way, 10 steps other ways. And these are going to be my primary abductors of my hip. But again, their main job, even though they are abduction, their main job is to just keep your hip nice and stable. So when you see people running, and we'll come back to a picture here when we get into their arthritis and sort of things like this, is that, when you watch people running, you can kind of watch them land and you're going to see their whole pelvis collapse, and that is a weakness of all these muscles and this inability to kind of stabilize my pelvis and my hips, okay? And I always do the Shamrock Shuffle every year downtown in the city, and what they do is they have a camera at the end so that if you know your time, you can sort of watch yourself coming across the line. And it's a great thing to kind of look and kind of analyze your stride and sort of see where you're weak and see what you need to work on, because it's a 5-mile race, and by the time you get to the end of that 5 miles, you're usually really tired and your form is going to start to deteriorate. So if you watch that in slow motion, you can see if your knees and your hips and everything is stable, or you can see like, hey, I need to work on my left glute or my right glute, or I need to work on my hamstring, or I need to do all these other things. If you look at a video earlier in the race when you're not tired, for most people, everything looks really good. If you can do the same thing with the marathons too, where if you look at people's form in the beginning, it looks really great. After they get to that 13, 14, 20 mile mark, that's where you're going to start to see where their weaknesses are and what things they should be working on in the off season. Okay, so Glute max, you got your glute medius here, glute minimus. The other important muscle in here, the only other one that I would ask you is going to be this piriformis. And the reason the piriformis, all these they're kind of like the rotator cuff of my hip. So their main job is to kind of hold that femur. But the piriformis is a special one because underneath it, you're going to have this sciatic nerve. Hear people talk about sciatica. And a lot of times, if these stabilizers of my hip are really, really tight and irritated, this muscle will get really tight and it'll start to compress that nerve and I'll start to get a lot of kind of pain down into my leg. So the way you're going to test for that is you're just going to stretch these muscles out. You're going to try to kind of put the person in a position where I'm going to tighten these muscles up. And then what you'll find is it'll compress that nerve and they'll kind of get that pain down into the leg. And then you can kind of know, okay, it's probably more the hip rotators and the stabilizers rather than is it coming from their discs and their back. So here's a picture of that piriformis muscle, and then here is a picture of that sciatic nerve. And again, sciatica is one of those terms where there's probably 20 things that it can kind of be caused by, but we group them all together. Very, very, very important to sort of know, okay, what is causing this pain down that back part of my leg, okay, instead of grouping it all together, because again, the treatments are going to be very different based on what's kind of causing that numbness and tingling down into the leg. This is a great book too. Obviously, for me, for coaching cross country, I've kind of gotten a lot of good ideas from this, but it's a great book that just kind of summarizes all the things that we just kind of talked about and just why this hip stability and this hip range of motion is so important. And what they're finding as we kind of move on to things and we sort of get more knowledgeable is that most back pain that they're finding, the key is this lack of mobility in our hip, okay? So they're finding that the key to keeping your back really healthy is to make sure you're keeping your hips nice and mobile and you're keeping them nice and stable, and then you're allowing your back to kind of, I don't want to have to get motion from my back because my hips are tight, okay? And this is really the key. You'd be amazed at how quickly people get rid of their back pain if you teach them how to kind of loosen up their hips and kind of get that motion back in there, especially for guys, right? Because guys we're going to more lack mobility, okay? And girls, a lot of times you're going to have a lot of mobility. You're just not going to be able to control it and sort of control the motion that you kind of have. So sometimes people come in with different kind of issues. Okay? But great book if you're just looking for an explanation of, what should you do and why should you do all these things, even if you're not a runner, okay? Because this comes in for, it's not just distance running. It can be, any sport where you're going to do a little bit of running. And then here is a picture of the lower leg. So on this one, again, I want to orientate myself so I can see that kneecap. I know I'm looking at the anterior part of my lower leg. I want to find that tibia, okay? And that's going to help me, I want to find the tibia. I want to find the fibula if I can, because that's going to, tell me medial versus lateral. And then I want to just start sort of getting all the basic muscles kind of down into this lower part of my leg. Okay, and we're going to look at the ones in the back. Those are the ones that people are familiar with. The main one in the front, okay, is going to be this tibialis anterior, and that's going to be the big, huge muscle kind of right beside that shin. When people talk about shin splints, a lot of the times this is kind of what they're talking about is that tib anterior. If it's on that lateral side, if they get pain on this medial side, it's usually going to be the tib posterior or some of the muscles that are towards the back, okay? But again, I want to find front, side, back, and then I can make sure I'm labeling everything properly. And then I can go back down to the ankle and I can be, okay, medial malleolus, lateral malleolus. Okay, when you look at the ankle from the side, again, I can see that fibula, so I know I'm looking at the lateral side. I can see the pinky toe, right? Which tells me, again, this is going to be the lateral side. These are going to be all the muscles. They're going to be everters, so they're going to kind of bend your ankle or put your sole kind of out to the lateral side. These are all the muscles that get irritated and they get damaged when I roll my ankle over in that, inversion sprain. These all muscles get a very, very big stretch and they kind of wrap around this ankle and they can kind of yank on all these bones in your foot. And I can get a lot of pain kind of up in that lateral part of my lower leg. Even though, I've mainly just kind of twisted my ankle, okay? Because you can tell from this picture, it's very, very difficult for these little muscles on the side here to control my ankle motion. And it's very similar, again, to the wrist where all the muscles that are controlling my ankle are actually very far away from the ankle, and it just makes their job that much harder, okay? And then I can start to see this big gastroc in the back, and I can start to see this soleus. We're going to see pictures of the calf muscles here in a second too, but you want to realize that these are two different muscles here, and they have to kind of work in unison, and that gastroc is going to be really, really important kind of with, plantar flexing or pointing my toes when my knee is straight, and then that soleus is going to be that little bit of lower pain, because a lot of people get like high calf pain and they'll get kind of lower pain. That lower pain is usually going to be that soleus, and that gastroc is usually going to be the one that's a little bit higher up, okay? So here is a picture of the gastrocs, and again I get a medial head, I get a lateral head, and then I can see this soleus here. And you'll see people at the gym where they'll do like a standing calf raise and they'll do a seated one. And this is kind of why if you're doing the standing one, you're working your gastrocs. If you're doing the seated one, because my knee is bent, I'm going to use that soleus. Most people in sports, they're going to have either that lower pain or that upper pain. This is a really serious injury because, again, these two muscles are going to come together. They're going to form this big tendon, right? Calcaneal tendon. Very, very serious injury just because we have poor blood supply to the ankle. It just doesn't heal really, really well. And this is, there's some injuries that you can kind of work through. Achilles tendon, calcaneal tendon pain is one of those where you really don't want to mess around because if you tear this tendon, sometimes it's just never the same. Okay, so it's one of those things where it's one where you want to kind of get it under control and make sure you're not making it worse and worse and worse till you get the point where you're going to end up with a tear in this tendon because again it just does not heal really, really well. Okay, so gastroc, soleus, and then obviously you got your Achilles tendon here on the back. If we take off the gastrocs, I can see the soleus a little better. Okay, but again, forming this big tendon, and again, sometimes you just have where that gastrocs and that soleus are just not running properly over top of each other, and that can get a lot of irritation and kind of pain that way too. If we take off the soleus, because a lot of people, we see the tib anterior, so that tells you there's going to be a tib posterior. And this is where I'm going to see that little tib posterior. And again, it's going to come and be on a little bit more towards that medial side of the shin. But it's really, really kind of deep in there. And again, just kind of buried underneath all these little muscles here. Okay, so here are the muscles in the foot. And I'm not going to make you know any of the muscles in the foot. I'm not going to ask you to label any of these. I just want to show you how busy and how complicated the muscles in your foot are. So it's very similar to your hand. There's a lot of muscles, a lot of tendons running in all these different directions. The biggest difference is that I have to bear weight on my feet, right? So that's the biggest difference between the lower extremity and the upper extremity is that weight bearing. And you can kind of feel, a lot of people get this plantar fasciitis and they get these pains in the foot. But you can see when I'm stepping down and I'm kind of running and jumping and landing on my feet, these muscles are really, really, really going to kind of take a beating, okay? And it's really easy based on, and a lot of foot pain and knee pain, again, is going to come from these unstable hips, okay? So if I can't keep my hips stable, my feet are going to get into bad positions. And a lot of fixing people's foot pain, even though it seems kind of strange, or fixing their knee pain is going to come from, again, getting them to do these hip stabilization exercises. But you can see that these muscles on the bottom of your foot have a big, 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 big job to do. Okay, and this is kind of what happens with plantar fasciitis, and this is one of those things that I hear this all the time. And again, these muscles on the bottom part of my feet, this is the bottom part of your foot. So what they're going to do is kind of curl your toes, right? So their job is to kind of flex those toes. Okay, and what they'll do to people when they get plantar fasciitis is they'll put them in this boot. And I can tell from this picture, and the problem with this is that they never get better. And it's one of those where when you go through anatomy and you sort of think about it logically, you realize like, okay, this is why it doesn't help. And what you see here is that this boot is kind of working on my ankle position, right? It's not really doing anything to my toes. It's really just keeping my ankle kind of dorsiflexed and keeping it in this position. It's actually stretching out my calf and my soleus for me. It's not doing anything to the muscles on the bottom of my feet. So what happens is people end up in this boot and they wear it for a really, really long period of time and they just don't get any better, okay? And the reason, again, is that they're not working on the proper muscles. So what they have now, and this is a great thing here, even though it's a little expensive, is they have this little sock. And the reason, this sock, I've told tons of runners and just tons of patients to kind of get the sock, even though they've had, some people have had plantar fasciitis for an extremely long period of time, and they always do better if they get this sock. And what you do is you wear this at nighttime, but it has this little strap here, okay? So you kind of put it on, you put the strap on, and you can tell with this one, what the strap is doing is it's pulling on your toes, okay? And it pulls your toes into extension, and it kind of puts these muscles in this stretched out position over nighttime. And what happens is they kind of adapt and they get stretched out and they get looser, and then it takes a lot of that stress off and takes a lot of that pain away. But the reason, just from a physiological, logical kind of point of view, the reason this one is so successful and this one is not, is because this one is not working on those muscles on the bottom of my foot, okay? And now that we sort of know our anatomy a little better, we kind of realize that, hey, like, what do these muscles do? This is doing nothing to the bottom of your foot, and this one is actually stretching out all those muscles on the bottom of my foot. And that's where just, things have to kind of make sense to you, and they have to kind of logically be like, okay, this makes sense, and this is why it's going to work, and this is why it's not going to work. You know, this picture here where you can tell it's stretching out the toes kind of lets you know, hey, we're working on that proper area. Okay, so if you know anybody that's had plantar fasciitis or you've had plantar fasciitis, and it's one of those things where you can struggle with it for a long period of time, this is one of the things that can be really beneficial. Okay. At the end of the PowerPoint for this one, I have this little muscle review quiz. This is up kind of in your module 2, but this is where I can just kind of go through all these muscles here, and this is where you can take your objective page, okay? And what you want to do is take your objective page and you have all your muscles that you're responsible for and that you need to be able to label, and you just want to go through all these pictures and make sure that I can find all the muscles on those objectives and I can find them in here. And then there's a couple more that maybe are not on your objectives that you're responsible for that we kind of talked about for like the quadriceps and different ones like that. But you just want to make sure these are the ones that you want to kind of focus on. And if you know these really well, there will be some pictures, kind of more actual pictures of like muscles and cadavers and things like that, but they'll be very similar to all the ones that you're going to see in here. So if you know this one really well and you just go through it a bunch of times, you'll do amazingly well on the practical. So practice this one. Practice the one with the landmarks for the bones, and then you'll be ready for that practical. Okay, so just another way that you can kind of practice. And again, you can put these on your phone, you can print them out, you want to be able to do it a bunch of times. This is one of the other pictures that we're going to be responsible for from the physiology chapter. And again, this is where I'm just coming down and we're going to go over this in the next part, where we go over a little more of the physiology and we go over a little more of the fibers and things like that for the muscles. Okay, so these last ones here are going to be from kind of the beginning of the chapter.